I need to tell you something that most doctors will never say to your face. If you have type 2 diabetes, or you have been told your blood sugar is creeping up, the medications you are taking right now are not fixing the problem. They are managing it. And there is a massive difference. Because while those pills are busy lowering numbers on a lab report, the actual cells responsible for producing your insulin are quietly dying off inside your pancreas. Nobody is talking about that. But today, I am going to walk you through a seed from India that costs about $2. And according to published clinical research, it contains compounds that can actually help rebuild those dying cells. My name is Dr. Marcus Ellington. I am a regenerative medicine specialist and cellular health expert based in Atlanta, Georgia. And for the last decade, my entire career has been built around one question. Why do we keep treating symptoms when the cells themselves are breaking down? I spent years in conventional practice watching patient after patient come through my office, and the pattern was always the same. Someone would get diagnosed with type 2 diabetes. Their doctor would put them on metformin, maybe a sulfonylurea, maybe eventually insulin injections. And for a while, the numbers looked better on paper. Fasting glucose would drop. Their A1C might improve a little. Everyone would say the treatment is working. But then a year or two later, the medication would stop being enough. The dosage would go up. A second drug would get added, then a third. And I would sit across from these patients, watching them get sicker and heavier and more frustrated, and I kept asking myself the same question. If the treatment is working, why do they keep getting worse? That question changed my entire career. I started digging into the research on what actually happens inside the pancreas of someone with type 2 diabetes, and what I found shook me to my core. Inside your pancreas, there are clusters of cells called the islets of Langerhans. Think of them as tiny factories scattered throughout the organ. Within those factories are specialized cells called beta cells, and these beta cells have one critical job. They produce insulin. Insulin is the hormone that unlocks your cells so glucose from the food you eat can get inside and be used for energy. When you are healthy, your beta cells respond to rising blood sugar by pumping out just the right amount of insulin. You eat a meal, glucose enters your bloodstream, your beta cells detect the rise, and they release precisely the amount of insulin needed to shuttle that glucose into your cells for energy. It is a beautifully calibrated system that works millions of times across your lifetime without you ever thinking about it. But when type 2 diabetes develops, two things start happening simultaneously. First, your body's cells become resistant to insulin. They stop responding to it properly. So your beta cells have to work overtime, pumping out more and more insulin just to get the same effect. And second, and this is the part that matters most, that constant overwork starts killing the beta cells themselves. Researchers at major endocrinology centers have documented this process extensively. By the time someone is diagnosed with type 2 diabetes, they have already lost somewhere between 50 and 80% of their beta cell function. Let me say that again. By the time your doctor tells you that you have diabetes, more than half of your insulin-producing cells may already be damaged or dead. And here's the part that makes me angry as a physician. The standard medications prescribed for type 2 diabetes do almost nothing to address this. Metformin works by reducing how much glucose your liver releases. Sulfonylureas squeeze more insulin out of whatever beta cells you have left. And insulin injections bypass your beta cells entirely. Not a single one of these approaches is designed to protect, repair, or regenerate the cells that are actually failing. That is like putting a bucket under a leaking roof instead of fixing the hole. The water keeps coming in. The damage keeps spreading, and eventually the whole structure collapses. So I shifted my entire focus toward regenerative medicine. I wanted to know if there was anything in the research, anything at all, that could help the body repair its own beta cells. And that search led me to a small amber-colored seed that has been sitting in Indian kitchens and Ayurvedic pharmacies for thousands of years. The seed is fenugreek. In India, they call it methi. It is one of the most commonly used spices across South Asia, showing up in curries, pickles, spice blends, and traditional remedies. The plant itself grows about 2 feet tall with small white flowers and long pods that contain these distinctly bitter, slightly sweet seeds. You can find a bag of fenugreek seeds at virtually any Indian grocery store or international market in the country for about $2. And here is what caught my attention. Fenugreek is not some new superfood that popped up on Instagram last year. This plant has documented medicinal use going back to 1500 BC. It appears in the Ebers Papyrus, one of the oldest known medical texts from ancient Egypt. Ayurvedic practitioners in India have prescribed it for metabolic conditions for centuries. It is referenced in the Karaka Samhita and Sushruta Samhita, two foundational Ayurvedic texts dating back to at least 500 BC. The ancient Greeks used it for respiratory and digestive conditions. During the Mughal period in India, fenugreek was traded extensively along spice routes, valued for both its culinary versatility and its medicinal applications. In rural Rajasthan, grandmothers still add a pinch of fenugreek to buttermilk for recovery and healing, a tradition that may be over 800 years old. India remains the world's largest producer of fenugreek today, though much of the crop is consumed domestically because demand is so high, but ancient tradition alone would not have been enough to convince me. What convinced me was the modern science, because researchers have now identified 4 specific bioactive compounds inside fenugreek seeds, and each one targets a different mechanism involved in type 2 diabetes. When I first saw the research laid out together, I understood why this seed has been used medicinally for millennia. It is not doing one thing, it is doing 4 things simultaneously. Let me walk you through each compound, because understanding the science is how you take control of your own health. The first compound is called 4-hydroxysoleucine. It is an amino acid that makes up about 1 to 3% of fenugreek seeds, and it is found almost nowhere else in nature. What makes this amino acid extraordinary is that it has been shown to stimulate insulin secretion directly from pancreatic beta cells, but only when blood glucose is elevated. That distinction matters enormously. Many diabetes drugs force your beta cells to pump out insulin constantly, whether your blood sugar is high or not, and that constant overstimulation is part of what exhausts and kills them. 4-hydroxysoleucine is different. It works with your body's existing glucose-sensing mechanisms, enhancing insulin release only when it is actually needed. Researchers have confirmed that it also improves glucose uptake in peripheral tissues like skeletal muscle and fat cells, which means your cells actually become better at using the insulin your body produces. The second compound is diosgenin, a steroidal saponin that makes up roughly 3 to 6% of fenugreek seeds, and this is the one that really stopped me in my tracks. In laboratory studies using diabetic rats, researchers found that diosgenin at doses of 5 to 10 milligrams per kilogram of body weight, administered over 30 days, triggered actual regeneration of pancreatic beta cells and increased the production of insulin granules within those cells. I want you to understand what that means. This compound did not just protect the remaining beta cells. It appeared to help grow new ones and increase their insulin-producing capacity. Diosgenin also has strong antioxidant properties, and it has been shown to elevate certain gene expression pathways, specifically PPAR-gamma and CEBP, that play important roles in metabolic regulation. The third compound is galactomannan, a soluble fiber that makes up a huge portion of fenugreek seeds, roughly 40 to 50% of the seed's total composition. This is the unsung hero. Galactomannan works by slowing down the absorption of carbohydrates in your digestive tract. When you eat a meal, especially one high in starches and sugars, the glucose from that meal normally floods into your bloodstream quickly, creating a spike that your beta cells have to scramble to address. Galactomannan slows that flood to a trickle. Studies on both animals and humans have shown that it reduces post-meal blood glucose spikes significantly, giving your beta cells breathing room. Think of it as taking the pressure off the workers in the factory so they can actually keep up with demand without burning out. The fourth compound is trigonelline, an alkaloid that makes up about 0.1 to 1.2% of the seed. Trigonelline targets the insulin signaling pathway directly. It has been shown to improve insulin receptor sensitivity by increasing a process called insulin receptor autophosphorylation. In plain terms, it helps your cells recognize and respond to insulin more effectively. It also promotes the translocation of glucose transporter 4 to the cell surface, which is the actual mechanism by which glucose enters your muscle and fat cells. When this process works well, your cells pull glucose out of the blood efficiently. When it does not work well, sugar stays in the blood and your A1C climbs. Now, I never recommend anything to my patients based on animal studies alone, so let me walk you through what the human clinical research actually shows. A double-blind, placebo-controlled study published in the Journal of the Association of Physicians of India took 25 newly diagnosed type 2 diabetes patients and divided them into 2 groups. One group received 1 gram per day of a hydroalcoholic extract of fenugreek seeds. The other group received a placebo with standard dietary and exercise counseling. After 2 months, the fenugreek group showed significantly lower blood glucose area under the curve, significantly lower insulin area under the curve, improved insulin sensitivity, and decreased insulin resistance as measured by the HOMA model. Their triglycerides dropped and their HDL cholesterol, the protective kind, increased. But the study that really got my attention was a 3-year prospective randomized controlled trial looking at whether fenugreek could actually prevent prediabetes from progressing to full-blown type 2 diabetes. The researchers used commercially available debiterized fenugreek powder administered daily. Over 3 years, the group taking fenugreek showed significantly reduced fasting plasma glucose and post-meal glucose levels. Their serum insulin levels improved, their insulin resistance decreased, and the conversion rate from prediabetes to diabetes was significantly lower in the fenugreek group compared to controls. 3 years of data, significant results, published in a peer-reviewed journal. A systematic review and meta-analysis published in 2023 looked at 14 randomized controlled trials involving 894 total participants. Across those studies, fenugreek consumption was associated with reduced fasting blood glucose, reduced post-meal blood glucose, and statistically significant reductions in HbA1c levels. The researchers noted that treatment durations longer than 8 weeks showed better results, and that randomized controlled trial designs produced the most reliable reductions. And then there are the animal studies that illuminate exactly why these human results are happening at the cellular level. Researchers found that fenugreek sprout extract administered to diabetic rats produced significant reductions in blood glucose levels, and when they examined the pancreatic tissue histologically, they found evidence of beta cell protection. The islet cells were preserved. The damage that uncontrolled diabetes typically causes to the pancreas was significantly reduced. So here's what I tell my patients. The evidence is strong enough that I think anyone managing type 2 diabetes or prediabetes should discuss fenugreek supplementation with their healthcare provider. But I also want to be direct with you about something important. Fenugreek is not a magic bullet. It is a tool. And tools only work if you know how to use them properly. Let me give you the protocol I walk my patients through in my clinic in Atlanta. The most effective delivery method based on the research is soaking fenugreek seeds in hot water. One study compared patients who consumed fenugreek seeds soaked in hot water versus those who mixed fenugreek with yogurt. The group that soaked the seeds in hot water saw significant reductions in fasting blood sugar, triglycerides, and VLDL cholesterol. The yogurt group did not see the same magnitude of improvement. The researchers believe hot water extraction helps release the bioactive compounds more effectively. Here's how I recommend doing it. Take about 10 grams of whole fenugreek seeds, which is roughly 2 teaspoons. Place them in a cup of hot water, not boiling, just hot, before you go to bed at night. Let them soak overnight for at least 8 hours. In the morning, drink the water and eat the softened seeds on an empty stomach, about 30 minutes before your first meal. The seeds will be soft and slightly gelatinous from the galactomannan fiber expanding. The taste is bitter. I will not sugarcoat that, pun intended, but you get used to it within a few days. If the bitterness is too much at first, you can start with 5 grams, which is about 1 teaspoon, and work your way up over a week or two. Some of my patients blend the soaked seeds into a small smoothie with a handful of berries and some unsweetened almond milk, which masks the bitterness without adding significant sugar. Now I need to talk about safety, because this is not optional. If you are currently taking diabetes medication, especially sulfonylurias or insulin, adding fenugreek to your routine could cause your blood sugar to drop too low. That is not a theoretical risk. It is a real one. Fenugreek enhances insulin secretion and improves insulin sensitivity, so combining it with drugs that do similar things can create a compounding effect. You must talk to your doctor before starting. Your medication dosages may need to be adjusted. I am not saying this to cover myself legally. I am saying it because hypoglycemia, blood sugar that drops dangerously low, can be a medical emergency. Also, if you are pregnant, especially in early pregnancy, high doses of fenugreek can stimulate uterine contractions. And if you have allergies to chickpeas or peanuts, proceed with caution because fenugreek belongs to the same legume family and cross reactions can occur. Now that we have covered what helps rebuild your beta cells, I need to talk about what is destroying them. Because taking fenugreek every morning while continuing the habits that are killing your pancreas is like bailing water while someone keeps poking new holes in the boat. The first beta cell killer is chronic hyperglycemia itself. This is what researchers call glucotoxicity. When your blood sugar stays elevated for extended periods, the excess glucose actually becomes toxic to your beta cells. It triggers oxidative stress, inflammation, and a process called apoptosis, which is programmed cell death. Every blood sugar spike that goes unchecked is doing direct damage to the cells you need most. This is why post-meal glucose management is arguably more important than your fasting number. That spike after lunch, after dinner, after that late-night snack, each one is a small assault on your remaining beta cells. The second killer is inflammatory seed oils. soybean oil, corn oil, canola oil, sunflower oil. These highly processed omega-6 oils are in virtually every packaged food, every restaurant meal, every fast food item you consume. They promote chronic low-grade inflammation throughout your body, and that inflammation accelerates beta cell destruction. When I audit my patients' diets, this is usually the biggest hidden source of metabolic damage. The salad dressing alone can undo hours of careful eating. Check the label on your bread, your crackers, your frozen meals. If you see soybean oil or canola oil listed in the first 5 ingredients, that product is contributing to the inflammatory environment that is killing your beta cells. Swap to extra virgin olive oil, avocado oil, or coconut oil for cooking. This one change alone can shift the inflammatory load on your pancreas dramatically. The third killer is sleep deprivation. When you consistently get fewer than 6 hours of sleep, your cortisol levels stay elevated, your insulin sensitivity drops, and your body enters a state of metabolic stress that directly impacts beta cell function. Researchers have shown that even a few nights of restricted sleep can significantly worsen glucose tolerance in otherwise healthy people. If you are already diabetic or pre-diabetic and you are sleeping 5 hours a night, you are accelerating the destruction of your remaining beta cells. The fourth killer is sitting still after meals. When you eat a meal and then sit on the couch for the next 3 hours, all of that glucose has nowhere to go except straight into your bloodstream, creating exactly the kind of spike that damages beta cells. But even a 10 to 15 minute walk after eating can reduce your post-meal blood glucose spike dramatically. Your muscles are the biggest glucose sinks in your body. When you move them, they pull sugar out of your blood without needing nearly as much insulin. That takes pressure off your beta cells immediately. The fifth killer is chronic psychological stress. Cortisol, the stress hormone, directly interferes with insulin signaling and promotes glucose release from the liver. When you are under constant stress, whether it is financial, relational, work-related, or emotional, your body is essentially fighting against your own metabolic health around the clock. I have seen patients whose blood sugar would not budge until they addressed the chronic stress in their lives. The body cannot heal in a state of constant alarm. So here is what the full picture looks like. You start each morning with your fenugreek seeds soaked overnight in hot water. You drink the water and eat the seeds 30 minutes before breakfast. You build your meals around whole foods, quality proteins, healthy fats from olive oil, avocado, and nuts, and complex carbohydrates from vegetables and legumes. You eliminate or drastically reduce processed seed oils. You walk for 10 to 15 minutes after every meal, especially dinner. You protect your sleep like it is medicine because it is. Aiming for 7 to 8 hours minimum, you address your stress through whatever works for you, whether that is prayer, meditation, deep breathing, time in nature, or counseling. And you make sure you are staying hydrated throughout the day, because dehydration alone can concentrate blood sugar and worsen insulin resistance. This is not complicated. None of this requires expensive equipment or a fancy gym membership or some exclusive supplement that only ships from one website. A bag of fenugreek seeds, a pair of walking shoes, a consistent sleep schedule, and real food. That is the foundation. And you work with your healthcare provider to monitor your numbers, because if this protocol works the way the research suggests it can, your medication needs may change. Your fasting glucose may start dropping. Your A1C may begin to improve. And that is not a problem. That is the goal. But you need a doctor who is paying attention and willing to adjust your treatment as your body starts healing itself. I got into regenerative medicine because I was tired of watching people decline on my watch. I was tired of the assembly line approach where we add another drug, increase another dose, and call it treatment while the patient keeps getting worse. I have sat across from too many people in their 50s and 60s who were told there is nothing else we can do, when the truth is, we never tried the right things in the first place. The human body has an extraordinary capacity to heal when you give it the right raw materials and remove what is causing the damage. I see it in my clinic every week. I see patients whose numbers start shifting within months when they commit to a regenerative approach. A $2 bag of fenugreek seeds from an Indian grocery store contains compounds that clinical research shows can help rebuild the very cells that type 2 diabetes is destroying. That is not fringe science. That is published, peer-reviewed evidence from randomized controlled trials. And the fact that most people have never heard of it says more about how medicine is practiced than it says about the quality of the evidence. If you are finding this helpful, hit subscribe. I cover cellular regeneration, anti-aging science, and the hidden causes of metabolic disease every single week on this channel. Your cells are listening to every choice you make. Make sure they are hearing the right message.